We're here today to give Tennesseans an opportunity to weigh in on the future of healthcare in this region and perhaps in our state. The proposed merger of systems in Northeast Tennessee and Southwest Virginia is a precedent-setting decision, and it's a big decision for this region and for Tennessee. It's the department's responsibility by law to ensure that the proposal would meet a clear and convincing standard, to provide a public benefit to the citizens of this region and ultimately all of Tennessee. This COPA process is important to the citizens of Tennessee, and the department is working diligently to fulfill its responsibilities in a timely manner and to be responsive and transparent throughout this complex process. These hearings are a part of ongoing conversations with key stakeholders so that there are a number of ways for people to get their perspectives and their opinions heard. We've also provided the ability for people to post comments on the Department of Health's website, easy to reach if you simply search the terms TN and COPA. The department is working as quickly as possible to move this process along. Just this past Friday, we met with the applicants to discuss the required plan of separation, and we look forward to receiving the information that we've requested. With that, I will turn this back over to Mr. Ackerman, who will conduct the hearing, and I look forward to hearing all of your comments. We're going to limit our comments to 3 minutes per speaker. I would ask you to respect that in the interest of everybody's time. And again, look forward to hearing your perspectives. And as Mr. Ackerman mentioned, this will not be the last opportunity for in-person comments, and you're certainly always welcome and encouraged to go to our website and provide written comments about this very important precedent-setting and critical decision for healthcare in Tennessee.
I would also like to introduce to you the other people at this table. At my far left, we have Malika Watson, Associate General Counsel for the Department of Health. Jane Young, General Counsel for the Department of Health. Of course, Dr. Dreisner and myself. And then we have Allison Thigpen, our Population Health Improvement Specialist, who has been working very, very diligently on getting us the information from the applicants so that we can move forward on this application.
Recently married with a new last name.
That's right. I'm sorry, I just gave her wrong last name. She's recently married. She's Allison Rajaratnam. So welcome all of you. And I think we have 2 state representatives here, and I'd like to give you all the opportunity to speak first, if that would work. Representative Holston, would you like to come first?
Thank you. Welcome to East Tennessee. Commissioner, it's good to see you again, and I appreciate all the effort in this process. I've noticed with health folks and health people and doctors, meetings can never be on the first floor. They're always on the 3rd floor to make people like me walk up all those steps. So I just want to know that I am so proud of the hospitals in this area and have been affiliated, at least as a customer, for several years. For 36 years in the police department, I went up there when I was beat up and cut up, and they always took care of me and did it well. And as you know, there's 2 level 1 trauma centers here. That's unheard of. There's only 6 in the whole state. 2 of them are right here. The whole point of all that is combined, these health systems should be able to offer, because of their health care and problem solving, second to none any place in the country. I convened a meeting just recently with hospital folks and stakeholders up in Bristol who are dealing, when I say problem solving, these are the kind of things that we're up against now that we didn't have 40 years ago. Emergency rooms are becoming dumping grounds for what I call throwaway people, or people who have no medical problems, but they end up in an emergency room, and hospitals are bleeding money trying to take care of folks that shouldn't even be there. And we had a meeting up there trying to solve those kinds of problems. It's not just that, mental health problems and issues and diabetes and heart problems and all those things, drug abuse, prescription abuse, all those things. We need folks on the cutting edge that together can solve problems for those kinds of things. I voted and supported this COPA bill when it came up recently in the House. And so it's going to be imperative that we solve problems in the medical field and pooling our resources and talent. And boy, we have it here. Pooling our talent gives us an edge for success. And I urge Tennessee Department of Health to grant this COPA to Wellmont and Mountain States. Thank you.
Thank you, sir.
Thank you very much, and that was 2 minutes on the dot, so we really do appreciate that. Representative Lundberg, would you come next, please? Thank you.
History is a great teacher. We learn a lot from history. It was just a couple decades ago that a hospital just down the road here, Holston Valley Hospital, and that board got together with Bristol Regional Medical Center and said, let's start something, because we're okay, but we can be better together. They created Wellmont Health System. 2 decades later, the wisdom of that decision changed the scope of healthcare in this region. It made it stronger for absolutely everyone here. Today, right now, I challenge you that the situation is remarkably similar. You have 2 systems that are doing okay, that can change the face of healthcare into ways we hope to achieve, from the educational initiatives, from healthcare and bringing people in. Those 2 independent hospitals getting together changed it in many, many ways. Because they were together, they could attract better physicians and surgeons, pay better. People came here for healthcare. That's what happened. I urge you most strongly to follow that wisdom from 20 years ago, so that 20 years from now we can look back and go, boy, those folks really had it together. Thank you very much.
Good evening. I am the president of Holston Valley Medical Center. I think it's extremely appropriate that today's hearing about our joint application for the Certificate of Public Advantage is being held in Kingsport. This community has the nickname as the Model City and is known for the way its initial layout and planning was done with a lot of precision on just an open piece of land almost 100 years ago. And that is exactly what Wellmont Health System and Mountain States Health Alliance are proposing to accomplish through our proposed merger. By coming together, our 2 organizations will be able to have a beneficial conversation about the most appropriate way we can serve our patients and broader community, both today and long term. We will be able to examine the best strategic direction not only for the proposed health system, but think critically about the best way to allocate limited resources for the patients we serve. Our current arrangement as independent organizations fosters an approach where Wellmont and Mountain States are encouraged to take competitive factors into consideration when we are deciding what services to offer and what pieces of equipment that we may purchase. While patient needs are certainly part of the equation, the thought process is also focused on maintaining and increasing our individual market share. Pardon the pun, but that is not the healthiest approach, especially when we consider the changing landscape in healthcare and the financial challenges that we face. As everyone in this room knows, reimbursements are not the same as they once were, and the more and more care is being delivered in outpatient settings versus hospital settings. That's good for the economy. As the president of Holston Valley, I'm responsible for ensuring that our hospital continues to meet the needs of our patients, physicians, and employees with the limited financial resources that we have available. I can tell you that is becoming increasingly a bigger and bigger challenge, one that we must confront with clearer thinking. So with scarcer resources, I think it's prudent for all of us to think about how we can deliver the highest quality care at the lowest possible cost with the greatest access. Can we accomplish those goals operating in the current scenario? I would respectively suggest that the chances of us attaining that standard long-term are not as high compared to the merger of the 2 systems. So I'm convinced that the best solution for Wellmont and Mountain States to merge and begin that dialogue with the community about what's the best way to leverage the resources that we have in the community. Holston Valley has been a proud member of Kingsport for more than 80 years. We came into existence with community support. We depend upon the community support, and we want to serve this community the best way we can. I think the best way for Holston Valley to continue to provide the best possible resources and services to this community is through a merger with Mountain States Health Alliance and Wellmont. Thank you.
You're well aware that the innovations and developments being proposed in our region are groundbreaking work. Enforceable commitments and state supervision put into place by the COPA are what makes the proposal of Mountain States and Wellmont so compelling, and it's so unique. It's not like any other merger that you would see in the United States because it does have that level of oversight. I've been in Kingsport since about 13 years now, and work not only at Indian Path Medical Center, but also I'm responsible for Norton Community Hospital up in Virginia, as well as Dickinson. So I have seen more than just the local area and the needs that are here. Our region is disproportionately affected by health issues like diabetes, heart disease, cancer. We see this high level of prevalence of negative health determinants like smoking, all of these types of physical inactivity that have created a generational problem for our area. The issues are extremely complex, and if we're going to end up bringing about any kind of meaningful change in our region's health status, we're going to need a regional strategy, not a competitive strategy as it's been for the last many, many years. That not only unites the efforts of the two health systems, it also builds bridges with other community and regional-based organizations that can impact our people's choices, lifestyles, and behavior. In the COPA, Mountain States and Wellmont have pledged an investment of at least $75 million in population health improvement. This investment would not be possible without the synergies that we will get through merging. In the COPA, the health systems have also pledged to invest at least $140 million in specialty services that are currently not available to the people in our region but are desperately needed. And those include places, subspecialties such as pediatrics, as well as community-based mental health services. I can tell you at Indian Path, I walk through that emergency room every day. I end up seeing these mental health patients that are seeking treatment, that we're trying to find places for to be able to receive the kind of care that they need. And when they're sitting there up to sometimes days waiting for transport, it's clear that there is a need for services like additional mobile crisis health management, as well as intensive mental health outpatient services. Both systems have made it clear that it's not possible, that if they're not permitted to merge, they'll likely have to seek outside. So I encourage you to be able to take a look very, very closely at this and support this merger effort for the good of our community.
Good evening. I'm Clark Jordan, Vice President and Assistant General Counsel with Eastman Chemical Company. As a self-insured business and one of the largest employers in the Tri-Cities region and in the state, Eastman has a vested interest in our health care. When we're recruiting new talent or we're seeking to retain our existing workforce, health care is a critical issue to them. They want to be sure that their families have access to the best health care teams and technology, and that their children are able to grow up in an environment that supports a healthy development. Mountain States and Wellmont have made clear that if they're not able to merge with each other, they may merge with other larger systems outside of the region. Given the choice of allowing the two to merge or allowing them to be sold to an out-of-state entity, I believe the proposed merger is by far the best choice. Strongly believe that the best way to protect access to quality health care for the unique needs of our region is to keep governance at a local level. I also believe that the merger of the two systems can result in benefits to the region that cannot otherwise be realized. In their application, the health systems have outlined commitments related to access and to community health that I believe are extremely important. The health systems have pledged at least $75 million in population health improvement efforts. We're particularly encouraged by this commitment because we believe regional approach to health improvement is the best way to have a meaningful impact on the biggest drivers of healthcare cost, while at the same time building a healthy future for children. We're particularly encouraged by the health system's commitment to $140 million to expand community-based mental health services, residential and outpatient addiction programs, and substance abuse prevention programs. We recognize the unique challenges of drug abuse and newborn addiction facing the region. We also support the effort of the healthcare systems to retain a strong local workforce. We're aware that when a larger out-of-area entity acquires a facility, they're likely to integrate the local back office support into an out-of-state area. We're encouraged that the merger will allow for those jobs to remain within the region. With the proposed new health system, we appreciate that there are enforceable commitments to place a limit on healthcare pricing growth in the region. It's extremely important to Eastman, as it is to other businesses in the area, to control these costs. In summary, I believe that the merger of the two health systems is the region's best alternative, and I'm excited about the possibilities that this merger presents for the region. I look forward to seeing what the combined systems can accomplish together. Thank you.
I'm Gary Mabry. I'm President and CEO of the Johnson City, Jonesboro, Washington County Chamber of Commerce. I reviewed some materials that in October of 2014 I presented a detailed report to the 47 directors on the two boards I work for, serve, and am proud to represent. In that report, we noted the reasons why the merger that we're here to discuss that's leading to a COPA would be extremely helpful to us, from new research opportunities, investment in addiction behavioral services, provide additional residency opportunities for the university and the like. During the course of this same time period, our respective chambers submitted a letter in May of this past spring. It's always good to know when we come together for something as important as business and healthcare, as important as it is to the economic development of our region. And we three chambers at that time said, we heartily encourage the merger and the COPA be approved. The benefits from the merger that have been provided in the study, and some of the information has been sent to you in the application, repurposing of dollars, the new research opportunities that I mentioned, creation of a healthcare system that will be equal to some of the larger systems that we know of in the South. Community health will improve, healthcare services will be enhanced, and of course access and repurposing of those vital dollars for our university and others will be the case. We sent to you another letter in July, and it merely said, we appreciate the historic work that you're doing, because it is historic, first time it's ever been done in our state. We recognize the great work of your staff, but our 47 directors in Johnson City once again said we encourage this merger. We'd love to see it occur, and we're looking forward to the approval of the application and moving on to the next process.
Good evening. I'm Mike McIntyre. My wife and I have lived in Kingsport for 50 years and have had the opportunity to utilize both systems on a number of occasions. We've always been pleased with the care and the outcome. I am currently serving as Vice Mayor of Kingsport. However, I'm here to present my thoughts and not necessarily the position of the city. I recognize that there are complex financial and service pressures challenging all healthcare systems today. Mergers are clearly the most obvious way to achieve cost savings while continuing to provide and improve medical care. The mergers of our two local systems can provide the necessary efficiencies to achieve the needed cost savings. This would also allow us to maintain control of our hospitals in this region and would enable us to focus on our region's unique health issues. A merger would prevent the flow of dollars out of our region that could support local medical care and services. I believe that the proposed merger has the highest probability of assuring high-quality medical care in our region for the foreseeable future. While a merger would likely result in some job losses, the two systems together should be able to offer better services, and will have a larger patient load that would enable adding some subspecialty services which now require patients to travel to systems in other cities. This would create jobs, help offset some job losses, and provide broader care. I think concerns about monopolistic issues are largely unfounded because procedure payments are controlled by Medicare, Medicaid, and the insurance companies. I certainly don't understand how a locally merged healthcare system could or would charge higher prices for medical service. And last, because the merged system would serve a much larger number of patients, the opportunity to expand medical-related research and training with East Tennessee State University and to more fully tackle public health issues including heart disease, diabetes, obesity, substance abuse, and mental health issues is a significant bonus that would help assure that our next generation is healthier than our current one. In addition, some economic development opportunities in the medical field should arise, which will support the growth of our region's economy. I believe these, as well as other factors, support your approval of the proposed merger of Wellmont Health Systems and Mountain State Health Alliance, and I strongly recommend your approval. Thank you.
Good evening. Again, my name is Ted Fields. I am currently the Executive Vice President for Tri-Summit Bank. Being a banker by trade, I am not immune to mergers, so I'm very familiar with those, having been on both ends. And I can assure you throughout my career, as a result of mergers I've gone through, things have been better. But today I come to you as my role with Wellmont. I currently serve as the chairperson for the Wellmont Foundation Board of Governors. And I want to take a couple of minutes and share a few thoughts with you regarding the pending merger of our two healthcare systems as it relates from the foundation perspective. Both healthcare systems have strong and established philanthropic foundations. I can tell you from my personal service on the Wellmont Foundation, which totals approximately 7 years, that this organization has put back millions of dollars into the local healthcare system to advance and enhance patient care and well-being in Northeast Tennessee and Southwest Virginia. My thoughts are that a combined foundation can and will continue to do amazing things within our community as it relates to healthcare. Just think if we combined those dollars as opposed to splitting them. A combined foundation will continue on with our philanthropic advances, which will lead to more services for our respective communities and continue to advance those causes that are near and dear to all of us. So to sum it up, I support and endorse the merger of our two healthcare systems, and I feel that our communities will be better served going forward. I also strongly believe that the combined philanthropic support from each of the foundations will be something that everyone in our community can and will be very proud of. Thank you.
Thank you very much. Jeffrey Alton.
I am against the merger. My understanding is the trauma center at Holston Valley is going to be eliminated. So that will all the patients coming out of Virginia stop at Holston Valley, be stabilized, and then sent on to the ones that have trauma centers. I am aware that if this does happen, there is going to be a bunch of specialists leave, which will create the staffing levels of the specialists at the different hospitals to be lower. What is going to happen is specialists will be going to other hospitals like surgeons. They will be operating in operating rooms they are not familiar with. They will be working with staff that they are not familiar with in the rooms, and that is going to lead to doctors not having confidence and a bigger possibility of mistakes in those rooms. I am aware that you have already had some specialists from one hospital go to other hospitals. What I have heard is that when this happens, the employees at the hospital they go to, it's like they dislike them and are not giving them complete cooperation like they get at where they're based at a regular hospital. And I know one of you is from the health department or whatever. I am aware that they are hiring a lot of nurses and they are being put through their trial period and then they get fired. The reason they get fired is they do not know the basics they should know. I would like to know if you all go to these training hospitals and let them know what the requirements are before the hospital will hire them that they need, instead of wanting the hospitals to train them furthermore to their standards.
Good evening, Commissioner and panel. My name is Dan Pullgears. Thank you for being here tonight, and thank you for giving me the opportunity to speak to you once again. I am an independent medical practice consultant here in the Tri-Cities. I represent several groups, but I am not here tonight representing any particular group. I would like to say that I applaud the Department of Health's transparency, and I am very delighted to hear that the department is continuing to seek a separation agreement with the COPA ruling. I believe that that's a very important part of the public advantage. I did want to just mention one other area in the literature that was put online, and also some information about the Tennessee Code. Per the rules of the Tennessee Department of Health Board for Licensing Healthcare Facilities, Chapter 1200-08-10-10.05, Standards for Ambulatory Surgical Treatment Centers, Section 6, it states, each ASTC must have a written transfer agreement with a local hospital. In the response submitted to the department's April 22nd, 2016 letter, Mountain States Health Alliance and Wellmont Health Systems have outlined several recommendations to prevent the new health system from reducing competition in the area. I suggest including language in Exhibit 10 under potential disadvantages of the proposed merger, subsection B, that should address this issue. As an example, I would suggest a number 7 to state, the new health system will grant a written transfer agreement to all licensed facilities in the geographic service area where such an agreement is mandated by the Tennessee Department of Health Board for Licensing Healthcare Facilities. Thank you very much for your time.
Good evening, and I just want to say I'm actually here wearing 3 hats tonight. So the first hat is for the Kingsport Chamber of Commerce. Our president could not be here due to vacation. But from the Chamber, we're just so happy and pleased that you're doing this in our community and letting our citizens be heard tonight. So we really appreciate your due diligence, the transparency of the process. I think that both sides, Wellmont and Mountain States, have done a great job just responding and being as transparent as they can in the process. It's a long process, but we're patient people. We're very patient. So the second hat that I'm wearing here today is I'm on the Wellmont board, and I've been on that board of directors for a number of years. And just from a hospital perspective, you know, the process, the length, the duration, it does make it difficult for us to recruit the best, you know, with the uncertainty there. So I know that you're doing the best that you can on the speed of getting this resolved, and we just appreciate that. And would love to see this resolved quickly. From a citizen perspective, I do live in Kingsport. I've been living here for 12 years. I've used the hospital at Holston Valley. And from a citizen perspective, I try to stay healthy. But if I am sick, I just want to know that there's access and enough supply. And I feel like the merger would be good for the community as far as extending that. So I am in support, and thank you for being here tonight and giving me an opportunity to speak to you.
Thank you.
Thank you.
Thank you very much. We took a short break this afternoon and walked around downtown Kingsport and had a really enjoyable time. So thank you for that. You're doing a great job here with your community.
Thank you.
Anyone else who would like to speak? Dr. Dreisner, would you like to close?
I would just say we got some really good information tonight, some things we heard before, some things we have not. Really appreciate your commitment to the process. Appreciate the fact that we have folks in the community who are willing to stand up and speak. And thank you for spending some time with us this evening. Have a great rest of your night.